Thank you, Terry, and thank you to NAPH for inviting me to do this duty this morning. For the last 2 decades, NAPH has been celebrating the outstanding work of safety net hospitals and health systems through its awards program. This year, the program was renamed the Gage Awards in honor of NAPH's founding president, Larry Gage, sitting right in front of me. More than 30 years ago, Larry had the vision to start NAPH with a focus on the unique needs of safety net providers and the vulnerable populations they serve. We think there's no better way to continue that vision by renaming these awards after Larry. To connect back to my day job at the Joint Commission, I'm also pleased to announce that as an expression of the Joint Commission's interest in quality and safety improvement in this nation's safety net hospitals, we, along with NAPH, are inviting you and your colleagues to submit papers for a special new ongoing series in the Joint Commission's Journal on Quality and Patient Safety. We're particularly interested in papers that deal with improvement programs and interventions specifically derived from the work done by your hospitals. As detailed in the call for papers, which is at all of your tables, the series is called Achieving Return on Investment in Performance Improvement. We all recognize the need to learn how to better show improvement and how it can bring solid returns in terms of safety, quality, efficiency, and perhaps most importantly, patient outcomes. I can think of no better laboratory for this work than your hospitals. We'll begin the ceremony shortly. Enjoy lunch. Thank you again. I hope everyone has enjoyed lunch, is continuing to enjoy dessert. We now are ready to celebrate the visionaries, some might even say mavericks, within the safety net by honoring NAPH members who embody innovation and excellence. By recognizing these programs, NAPH strives to spread the word about the outstanding work of its members and document important lessons in successfully implementing the hard work of improvement. This year's awards recognize organizations for programs demonstrating unparalleled excellence in improving healthcare delivery, access, or value to specific populations served within their communities and the reduction and elimination of harmful events to patients. I had the privilege and the challenge, I might say, of being among those who reviewed all 36 submissions for this year's program. Each and every one of those submissions demonstrated the drive and the commitment to serving their patients and their communities in powerful and innovative ways. I'd like to take a minute to recognize the other members of the awards selection committee who labored with me in narrowing the field, which wasn't easy, to just a handful of winners. And their names are on the screen, and let's give them all a round of applause. And now I'd like to invite the NAPH incoming chair-elect, Tom Traylor, to please join me on the stage, and he will assist with the distribution of these wonderful awards. So let's get started while Tom is making his way up. The first award of the afternoon is an honorable mention in our patient safety and quality category. Santa Clara Valley Medical Center, easy for you to say, center's program to eliminate hypothermia in low birth weight infants. Tell you a little bit about the program. Newborns weighing less than 1,500 grams are considered very low birth weight. For those extremely premature infants, each degree Celsius decrease in admission temperature below 36 degrees creates a 28% increase in mortality and an 11% increase in the incidence of sepsis. In early 2006, Santa Clara Valley Medical Center recognized that their rate of very low birth weight infants with hypothermia admitted to its NICU was 44%. In response, the medical center developed a thermoregulation guideline for standardizing temperature management in these infants using the Neonatal Resuscitation Program and the California Perinatal Quality Care Collaborative Best Practice Guidelines for preventing hypothermia. Let's watch the video to learn a little more about their life-saving program.
In December 2005, Santa Clara Valley Medical Center noted that a 26-week premature infant had an admission temperature of 33.2 degrees Celsius. The infant's temperature was still 35.8 degrees Celsius at 14 hours of life, despite interventions to correct hypothermia. Staff then proceeded to collect 6 months of baseline data to determine the rate of hypothermia in very low birth weight infants. They found it was 44%. To correct the high occurrence of this preventable condition, a multidisciplinary staff team developed a policy to thermoregulate these infants. They standardized delivery room management, including using thermal equipment such as heat lamps and heating mattresses, delaying cord clamping, and monitoring environmental factors, such as operating room temperature. Resident physicians, faculty, nurses, and other staff received intense training via grand rounds, skills workshops, and simulations. And all deliveries were recorded to provide multidisciplinary teams feedback on resuscitations. By using these new guidelines and implementing organization-wide training, Santa Clara Valley Medical Center reduced the rate of hypothermia in very low birth weight infants from a baseline of 44% in early 2006 to 0 in January 2009. Ongoing staff education and feedback has sustained the 0% rate in 2011.
For their commitment to using evidence-based care, standardized guidelines, interdepartment collaboration, and organization-wide training, we recognize Santa Clara Valley Medical Center. Accepting the award on their behalf are Matt Garrier, Director of Inpatient Acute Care Nursing, and Madhu Manani, Nurse Coordinator. Please join us.
Wasn't it W.C. Fields that said never work with children or animals, right? So, but I've sort of spent my entire career going against that. There's just a few people I wanted to thank, and I'll make this short and sweet so I don't hear the music at the end here, as somebody warned me about earlier. First and foremost, I want to thank Madhu Manani, who's here with me, and Lynn Showalter, our staff educator, for their dedication and recognition of this phenomenon, and then putting together the statistics to try to get us to a point where we're in great shape, as you saw on the slide up here. Several other people, we talked about the physicians and their collaboration. I want to personally thank Dr. Balaji Govindaswamy. He's here with us today for his support. Very collaborative physician. That's our neonatal director, medical director. And without his help and his support and his medical staff being on board with this same change, we could not have achieved that. The nurses, physicians, and staff at Santa Clara Valley Medical Center do some amazingly wonderful things. And I've been associated with for-profits in the past and the not-for-profit and community public-based hospital system now for a few years. And I will tell you the satisfaction with delivering care to folks that are in need such as this at our medical center is just a wonderful thing. I'd also like to thank Trudy Johnson, our new interim CEO, who's here in the audience with us, for her support as both formerly my chief nursing officer, who I directly reported to, and actually now is our new CEO. Dr. Cliff Wang, Renee Santiago, Liz Niss, and the Board of Supervisors, the NAPH Selection Committee, and Dr. Gage for starting all this to begin with. So I appreciate that. Thank you.
As the measurement guy at the Joint Commission, it always comes down to measurement, doesn't it? Central line bloodstream infections, often called CLABSIs, are infections that occur when bacteria enter the bloodstream through a central line. CLABSIs are among the most serious hospital-acquired infections and eliminating them, as most of you are well aware, has become a national priority. New Health, Nassau University Medical Center, our winner for quality and patient safety, realized this issue should be a priority improvement area and took a comprehensive and systematic approach to eliminating CLABSIs. To transform its process of care to reducing CLABSI, New Health implemented a robust performance improvement effort directed by the Chief Executive Officer, the Executive Vice President of Medical Affairs and Medical Director, and the Executive Vice President of Operations. A dedicated team was formed to improve procedures for inserting and maintaining central lines and monitoring patient risk. Let's watch their approach and their success.
With a newly adopted performance improvement priority to reach zero CLABSIs, New Health Nassau University Medical Center developed a systemic approach to changing the organization's culture in order to create sustainable, long-term improvements. Changes were made to clinical practice, communication between caregivers, education, and accountability from the bedside to the leadership level. 3 key elements of this culture change include teamwork, ownership, and feedback. By drawing on these elements and establishing champions, the entire organization embraced the call for change.
Ownership. Everyone thought that this was their own job to ensure that we became an infection-free institution.
The team identified critical components of central line care and provided real-time feedback on predetermined criteria to the bedside practitioners, medical director, and senior vice president of nursing. In this way, clinicians and proceduralists could ensure evidence-based guidelines were followed. For any identified CLABSI, New Health convened a special case review, identified immediate and long-term issues, and implemented action plans. The team also held follow-up meetings to ensure sustainability and accountability.
It's a credit to this institution that we were able to do this with such a wonderful collaboration between the physicians and the nursing.
A program evaluation performed at the end of 2010, 8 months after project initiation, found that the average monthly CLABSIs had decreased by 74%, and the median reduced from 3 CLABSIs per month to just 1.
Teamwork and culture change. For their comprehensive approach to quality improvement, we recognize New Health as the 2012 winner of the Gage Award for Quality and Patient Safety. Accepting the award on behalf of New Health Nassau University Medical Center is Art Gianelli, President and CEO, and Maureen Shannon, Vice President of Quality Management.
So I just got a tweet from my staff back home saying, Art Gianelli, we're all watching. So to my colleagues and my staff and my team back at the Nassau University Medical Center, let me give you a shout out and say hello. And thank all of you for the wonderful work you did in making it possible for us to stand here today and accept this award. Let me thank Siemens for hosting this event. I want to thank Jared Loeb. I want to thank Larry Gage, for whom these awards are now named. I count Larry as a mentor and as a friend. Larry's idea more than 30 years ago has resulted in an organization of tremendous importance to all of us in this room and to people vulnerable populations all throughout this country. And Larry is to be recognized for that. And I'm so glad that these awards were named in his honor. And I also want to thank Bruce Siegel for his amazing stewardship of this organization and taking the baton from Larry just a couple of years ago. I have plaque on my desk that says, success is defined as getting up one more time than you fall down. And when I started at the National University Medical Center 6 years ago, we were facing incredible challenges. We had failed our Joint Commission survey when I had arrived, and we had two, not one but two, and believe it or not, and we had not one but two consent orders with the Department of Justice for quality of care issues. Now, this all happened before I got there, I have to say. But it really did. But in the ensuing 6 years, what became clear is that the organization had some stellar clinical professionals, and what they lacked was leadership that believed in them and was willing to work with them. And that's what I hope that we were able to bring to the table. And in these 6 years, we have now nationally recognized programs. We have award-winning programs throughout our organization. And really, this award for patient safety is a pinnacle achievement in our organization. You have no idea how much it means to us to be able to show and to say, for all the world to see, that the care that's delivered at the Nassau University Medical Center is amongst the best care delivered anywhere in the United States of America. This award means that much to us. We thank you again for recognizing the work of our outstanding clinicians, and I want to congratulate also our fellow award winners for their work. Public hospitals deliver the best possible care to the nation's most vulnerable populations. That's our message, that's our mantra, that's critical, it seems to me, for understanding how we're going to be successful in the future. We're not places of last resort. We're places where top-flight care can be given to everyone, regardless of circumstance, regardless of need, regardless of condition. And that's why I think we're all here, and that's why we at the Nassau University Medical Center are so honored to be receiving this award today. Thank you very much.
Our second category of awards recognizes innovative programs in population health. For this category, we have two honorable mentions. The first honorable mention for the population health category recognizes Lee Memorial Health System in Fort Myers, Florida. The Dunbar community serviced by Lee Memorial is a high-risk, low-income area in which patients have limited access to primary care. A 2007 study showed poorer health and higher percentages of chronic disease in Dunbar compared with the rest of Lee County. In Dunbar and other communities like it, many low-income and uninsured patients do not have a medical home. They use the emergency room as their primary care facility, which drives up healthcare costs, and indeed, the emergency room, I believe, is a window to a broken healthcare system nationwide. To tackle this problem, Lee Memorial opened the Lee Physician Group Dunbar Clinic in 2011 to provide primary care to high-risk patients in the area. The clinic shares space with a variety of United Way-funded social service organizations, creating a one-stop shop for health and social support services. Let's watch and learn more about the clinic's services and its impact on the community.
Lee Memorial Health System opened the Lee Physician Group Dunbar Clinic in 2011 to provide primary care to high-risk patients. Creating this type of medical home reduces emergency department visits.
The key here is access. You know, if you have access to health care, you usually lead healthier lives.
The clinic provides primary care, disease management programs, and specialty care.
Different disease management goals, including diabetes, congestive heart failure, asthma.
With state grant funding and support from Lee Memorial's entire system, the clinic is filling a vital need.
You know, Lee Memorial is committed to this community. They really saw the need there, and they went in and stepped up to the plate and provided the services that that community is going to need.
In its first 6 months of operation, the clinic saw more than 400 patients. Of those, only 2 patients utilized the ER since enrolling in the clinic. Other successes include 61 patients receiving mammograms, 40 patients enrolling in a diabetes management program, and more than 100 previously uninsured patients converting to Medicaid. Today, the clinic sees an average of 350 visits and creates more than 150 links to specialty and support services per month.
The clinic is promoting individual chronic disease management and reducing costly ER visits and hospitalizations, leading to improved patient and community health.
This is going to focus on prevention, decrease the admissions to the ER, and allow that community to live healthier lives.
For their support of their community's health, we recognize Lee Memorial Health Services. However, unfortunately, Larry Antonucci, the Chief Operating Officer, is ill and is unable to be here today. But Tom and I will accept with pride this award for Larry, and no, neither of us will take it home. We will make sure it goes where it belongs. So a round of applause. Our second honorable mention for population health recognizes Wishard Health Services. Certain patient populations are more likely to become incapacitated and require assistance with health care and financial decisions. Many of these patients are alone in their communities or have abusive family members. For those who have not made prior arrangements or who lack resources, public guardianship services are often the only option. Serving as the public health care system in Indianapolis, Wishard Health Services places a special emphasis on the vulnerable populations of Marion County. Because there currently is no comprehensive effort to address the community's overall guardianship needs, the Wishard Volunteer Advocates Program was created. The program provides volunteer guardian services to protect the health, well-being, and safety of ill and at-risk adults and seniors who have no family or close friends to turn to and are incapable of advocating for their own health care. Let's watch the video to learn a little bit more.
Wishard Health Services in Indianapolis is one of the 5 largest safety net healthcare systems in the country. Many of its patients have no support system and cannot make decisions on their own. These patients include seniors with dementia, the mentally ill, or developmentally disabled patients. For the community serviced by Wishard, the existing Guardian program provided support only if patients were indigent, on Medicaid, or in an institution such as a nursing facility. With many patients left without guardianship or a healthcare advocate, Wishard decided to take action. Authorized by Indiana law, the Wishard Volunteer Advocates Program recruits and trains volunteer advocates to serve as court-appointed guardians. Applying strong standards for its volunteers, the program is a member of the National Guardianship Association and adheres to the NGA Code of Ethics for guardians and guardianship agencies. Volunteers are assigned to only one patient at a time and are required to see patients at least once per month after they return home or are placed in a nursing facility. Since 2010, Wishard has trained and certified 54 volunteers who have supported 39 patients. With the improved advocacy and communication efforts of these volunteers, readmissions and transfers to hospitals have reduced, and Wishard's patients are healthier and safer.
For their creative solution to improving the community's health, we recognize Wishard Health Services. Accepting the Gage Award on behalf of Wishard Health Services is Lisa Harris, President and CEO.
So I'm sitting here thinking this is an example of how what goes around comes around in a very positive way here at NAPH. I'm very honored and grateful to have the opportunity to accept this award, and it started actually as an extension of our medical legal partnership that we borrowed from Boston Medical Center and established, 5 or 6 years ago. And so this is just the latest manifestation, and it's how we all borrow from each other. We take pages from each other's playbooks, and we get better. So you've heard about the program. What's interesting is that a good portion of the volunteer advocates are retirees from our health centers, just our health system. It's just one more way that people find ways to stay engaged. You know, it's hard to disconnect from the community that we become so engaged with in our system. So many of the volunteers are retirees. Some of them are medical students. I'm here accepting this award on behalf of our team because our team is back home training the next group of volunteer advocates. We do it in conjunction with the law school. So that schedule had long ago been set. And Robin Bandy, who runs the program, she's the JD and was just just full of passion for the patients. She's back doing what hundreds of thousands of people across all the communities we came from are back home doing. So I accept this on behalf of her and all those people who are back in all of our homes making a difference one patient at a time. Thank you.
Harris County Hospital District, the winner of our population health category, faced grueling statistics. 45% of the adult population in Harris County was obese. 55% of the pediatric population was overweight or obese. Increasing numbers of younger patients had chronic diseases such as diabetes. Harris County ranked last out of 221 counties for having a physical environment that promotes health. 75% of the area residents did not consume the recommended amounts of fruits and vegetables. And Harris County's communities were lower than the national average per capita prevalence of supermarkets. The staff at Harris County Hospital District decided to look for a community-based solution that would provide long-term, sustainable change in vulnerable populations typically seen at their, and likely your, hospitals. The change they wanted included improved health, disease prevention, and increased physician engagement. Harris County's efforts to create this change will surely establish the hospital district as a leader in health promotion and disease prevention in low-income communities. Let's watch a short video.
Faced with a high prevalence of excess weight in both adult and pediatric patients, as well as a growing number of children with chronic diseases such as diabetes, the Harris County Hospital District in Texas launched a program to educate patients and their families about the importance of consuming fresh fruits and vegetables and to improve access to market fresh produce.
The opportunity to get quality food at reduced prices, it makes perfect sense because we're into wellness, not sickness.
Healthy Harvest is a collaborative effort between the Harris County Hospital District and Veggie Pals, a local nonprofit organization. Healthy Harvest markets are held 1 to 2 days a week. They provide low-cost fresh produce and nutrition education to low-income and vulnerable patients. Special attention is given to cultural preferences when selecting the food for each market.
And one of the challenges that patients have is that it's often really expensive to do that, and it's also really hard to get to stores, especially if you live in parts of town where there aren't very many grocery stores.
Each of the 5 pilot sites is serving 75 to 150 patients and selling between 300 and 500 pounds of produce each week. This equals 3 to 5 tons of fruits and vegetables sold within the first 2 months of the program. Due to the positive and enthusiastic response from their patients, health center staff, and nearby community residents, 5 additional sites were established in February 2012, more than doubling the number of patients served.
What we're doing right now has very significant long-term impact with a reduction in admissions, with less acute care, with more people being healthy. That'll help our community not only with better lifestyles, but also reduce the cost overall of healthcare in our community.
Accepting the Gage Award on behalf of the Harris County Hospital District is Ann Smith Barnes, Medical Director for Weight Management Services and Disease Prevention.
does an apple a day really keep the doctor away? Maybe not entirely, but perhaps an apple a day helps patients not need to come to our facilities as often. It is with great pleasure and gratitude that I accept this award on behalf of the Harris County Hospital District in Texas. I would also like to thank our CEO, David Lopez, whose support was critical, and to acknowledge our community collaborator, Veggie Pals, who helped to make the initiative a reality. Our health system is committed to improving the health of our communities we serve through primary, preventive, and wellness care. We believe strategies like Healthy Harvest support patients and communities in their quest for better health. We also believe that meeting a patient's basic needs is the epitome of patient-centeredness. We hope others will consider stealing this idea and joining us in the growing movement to make healthy choices the easier choice. Thank you very much.
Some say stealing is like R&D, rob and deploy. You know, some of you that follow what the Joint Commission has been doing lately would realize that we've spent a lot of time talking about high reliability organizations, or HROs. And as Mark Chassid and I have written about this, we've talked about the three components that are really necessary requirements for high reliability organizations. They require leadership commitment, they require the creation of a safety culture, and they require the use of robust process improvement tools. And I think you've seen that demonstrated among all the winners, whether they be honorable mentions or winners in the categories presented today. I think, taken together, these awardees represent an incredible display of quality, innovation, patient-centered care, compassion, and they exemplify what's right in healthcare. In statistical terms, we often talk about outliers. Usually, we refer to these outliers on the negative side of that normal curve, but what you've seen presented today are the outliers on the correct side, on the right side of that curve. This is what we should all seek to emulate. I'd now like to invite the namesake for these awards, my friend Larry Gage, the founding president of NAPH, to address you. Larry?
Thank you very much, Jared. I am both honored and truly humbled to have my name associated with such outstanding innovation. And to look out at all of you in this room and see old friends and many newcomers just leads me to be convinced more than ever, even a year after turning the title over to Bruce, that this is an extraordinary community. I certainly appreciate the opportunity to continue to meet with you and to work with many of you. Since there's been a lot of talk about borrowing and stealing, I will make one confession. Some of you who do go back a while know that NAPH was started in 1981, and then just a year or two later, our California members started CAPH. So we did come first, but the concept of this award ceremony we stole from CAPH. So I want to thank Melissa, wherever you are, and the members of CAPH. You did it first, and it was such an amazing event the first time I attended the meeting where you presented these awards that we said we had to do it nationally. And similarly, we can all learn from one another. I'm not up here to give a speech, but I want to close with a quote, which I discovered a couple weeks ago, and I used last week actually at an Arrowhead Medical Center leadership retreat. Because I think there's a lot of similarity in terms of the pace of change we are enduring now, not just in the public hospital industry, but in healthcare generally. And there's a similarity to the pace of change really over the last 10 or 20 years in the whole computer and high-tech industry. And so I did stumble on a quote. Former IBM CEO Lou Gerstner wrote a book called which is very appropriate for many of you in this room. It's called Who Said Elephants Can't Dance? And he's really talking about IBM's near-death experience in the 1990s and how they went about resurrecting themselves. And he said, all of the assets that the company needed to succeed were in place. But in every case, hardware, technology, software, even services, all of these capabilities were part of a business model that had fallen wildly out of step with marketplace realities. IBM had failed to adapt as customers, technology, and competitors changed. We had to take our businesses, our products, and our people out of a self-contained, self-sustaining world and make them thrive in a real world. It was like taking a lion raised for all of its life in captivity and suddenly teaching it to survive in the jungle. And I give you that quote because when I look at the extraordinary things NAPH is doing at the national level and that CAPH is doing here in California to assist you in retraining the lions, I think that you're in good hands. Bruce's leadership is extraordinary. All of the staff, the new staff, and the older folks who have been around a while at NAPH are really here to help and to serve you. And as we always say at these sessions, in the past, a commercial for the awards, you can't win one if you don't submit an application or nominate someone for them. So I really urge you to get involved both in the innovative activities of the Transformation Center and the other initiatives at the national level, but also to continue to learn for the rest of this meeting and for the next several years from one another. Thank you very much for this honor.